Next technique we're going to look at is the scalenes. The scalenes are generally tight on most clients that I practice on. We're going to look at releasing the anterior, the medial, and the posterior aspect of the scalenes. So what I'm actually going to be doing is I'm going to be gliding down the transverse processes of the vertebrae with 2 or 3 fingertips. I glide down and get the anterior aspect, and then right along perpendicular to the transverse processes I'm going to get the medial scalenes, and I'm just going to gently hook underneath the transverse processes and get the posterior aspect. Word of caution, we don't want to go too anterior off the transverse processes because that'll get us into the carotid artery. So if you feel a pulse, you've gone too far medially. Carotid artery will sit right about here. I'm also going to get a motion involved, so what I'm going to have Anthony do, he's going to reach down with his hand on the same side. I'm also going to get him to rotate his head to the opposite side. And I'll explain that in just a minute. I'm going to get Anthony just to gently lift his head off the table. And what that does, it actually contracts the sternocleidomastoid muscle. And Anthony, come back down. So at the top portion, which attaches onto the mastoid process, and Anthony's going to relax now. So I've kind of hooked up and underneath. So now I'm right on the scalenes tissue. And I can feel the transverse processes as well. So I'm gliding down the transverse processes, down the spine, and I'm heading towards the clavicle. And I stop just about where the brachial plexus starts, in about this direction. So I stop right about here. Once again, I'm going to landmark. Anthony's going to lift his head up and relax. Now I'm going to get the medial aspect of the scalenes. So I'm just perpendicular now to those transverse processes. I'm gliding down. And then finally, I want to hook up and underneath and get the posterior aspect of the scalene tissue. You don't necessarily have to get the client to lift their head up each and every time. If they come in with acute whiplash, I would highly recommend that they don't, because that'll be excruciatingly painful for them. So we're going to add some active myofascial release to this technique. Anthony's going to rotate his head to the opposite side. And he's going to actually keep his shoulder on the table, but he's going to reach down with his fingertips, almost like he's trying to touch his toes. So here I am gliding down the scalene tissue. Anthony's reaching with his fingertips of his hand and rotating the head in the opposite direction.